You cannot ask for a good job to the technician if the implant is not in the perfect position.
That's true. But how you start to educating the patient?
So psychologically, this is not the patient. If you selected the wrong patients, you're going to fail a lot.
Did you reject some of them?
Yes, from time to time.
Doing prosthodontist or periodontist?
I think I enjoy more the blood, as I said before, because blood is like a drug for me right now. I need blood. I'm like a vampire.
So how you manage that?
The key in this time management issue is my wife. My wife is my boss, but not only at home.
Did she fire you?
From time to
Many
time,
times,
punished me, not fire, because, this is a good business relationship in the end. Yeah. Now, Ramon, we understand how do you do it.
Hello everyone and welcome to Charismatic podcast. Today's podcast is very special because we have very special guest. Dr. Ramon Gomez came all the way from Spain to Dubai to make this podcast, and of course he has a lot of presentations to make and a lot of events to do. He's a busy man. So Dr. Ramon Gomez, he's one of the famous international speaker. He speaks about the periodontist and aesthetic dentistry, as well as he is well known with the multidisciplinary treatment plan because he studied ortho, perio, and prosto all together. So when he has a case, he doesn't want to consult anyone. He can do it alone. And yes, Dr. Ramon Gomez has a lot of awards, from the academical excellence to the practical excellence as well. He studied in Spain, and he's a professor in New Orleans, USA. Also, he's the founder of MEDA Training Center in Spain with 2 branches. Dr. Ramon Gomez, it's a pleasure to have you here.
Thank you so much. It's my pleasure. Thank you so much.
Thank
I
you
was
for being
enjoying our conversation before starting with the podcast.
Yeah. Can you tell us more about your study, your journey of the graduating and post-graduating?
Yes, no problem at all. Well, I try to summarize because it's been a long way. I wanted to be a dentist since I was a kid, 11 years old, because my father said to me, you can't be a dentist, because I loved, to do things with my hands and to fix things. And I went to the dentist and I was amazed by the profession.
But your father wasn't a dentist.
And no, it wasn't. He was not a dentist, but I did like biology and medicine. At that time, you had to study medicine before being a dentist, and I actually wanted to study medicine. But then the degree changed a few years before I started, and I went to Santiago de Compostela, and there I got my degree. And then you start in this kind of moment that you're very young, you don't really know what you want to do, as we were talking about before. And I decided to study ortho, but because I didn't know anything about orthodontics, it seemed so complicated at the moment. So I started studying ortho.
Why you decided ortho?
Because I think you want to know about those things that are so unknown, and the orthodontics at that moment. Nobody taught you orthodontics during the 5 years at the university. You had to go into a postgraduate program, and it was difficult at that moment. It's nowadays you have hundreds of courses, thousands. You can study. You can go at private universities, but not at that moment. You needed top marks in order to go into the university.
So it wasn't that easy to get
No,
there.
it was really difficult. So actually, there were 50 spots, and half of us had top grades, But I didn't have any problem with that because I always, being the first one studying, it was easy for me, I could study everything without any problem, any career. And, I studied orthodontics, but then at the same time, You know how it works. Life is different, and I needed a little bit of money for myself. I started working in a practice, and the guy was a periodontist and endodontist as well. I came across the microscope, but I'm telling you, more than 20 years ago, the microscope, nobody had a microscope. Only
At that time.
Exactly, only 3 guys in Spain, and periodontists, there were only a few periodontists in Spain. So I fell in love with periodontics because harvesting.
Are you sure at that time only 3 dentists, only 3 periodontists?
No, only 3 microscopes.
Microscope with
And
periodontists.
a few periodontists in Spain. In the 90s, you had the Perio Society.
Yeah.
Nowadays, the Spanish Perio Society is the biggest
huge.
in Europe.
Yeah.
At that time, of course, in the 80s, I was a kid. I was not studying dentistry. But in the 80s, I know an old periodontist that who told me the society was tiny. And when I was 2 years ago in South Africa lecturing, I lectured for the South African Perio Society, and there are 30 guys. So more or less it's the same, because at the beginning, everything is small. Anyway, I fell in love with periodontics. For me, taking a piece of gum from the palate and to graft it in the lower jaw, it was kind of magic. Imagine I was very young. I was a kid. And nobody was interested in periodontics. I started performing soft tissue grafts. And yes, in Madrid, in Barcelona, few guys. You have to realize these are big cities. Few guys in the 90s were doing periodontics. Yeah, I mean soft tissue grafts.
Yeah.
Because they had 20, 30 hygienists working for them, and they were millionaires. They were playing golf. They didn't care about soft tissue grafting. That was another word. It seems that is yesterday, but in 20 years, dentistry has changed a lot.
Wow.
And I remember I ended up, to make a long story short, a friend of mine came to my office and he said to me, you have to lecture. I said, no way. I am less than 30 years old. I'm still studying. I studied occlusion, prosto. I was constantly studying, never practicing more than 3 days.
But you were practicing. You were
but I never practiced 5 days a week. I practiced around 3 days a week, 4 days maximum sometimes, and the rest of the week I was studying.
Studying.
Yes, always attending courses, going to the university. I'm trying to make a long story short, but I was a professor in several departments. I had the scholarships, but never practice. I've never practiced the whole week. And I recommend young guys, don't practice for 5 days. Because if you practice for 5 days, you will burn out very easily. And you need to discover new things. Dentistry is so complex, and you have to discover what you like most. Because look at me, I started with with orthodontics. I ended up with periodontics. You know what? I was afraid of blood when I was a kid. Not afraid, but I passed away. And then it's like a drug for me right now. I need blood. I'm like a vampire. And when people ask me, did you plan about this? No, you cannot plan everything in life. I don't know your own story, only part of it. But I think many times it's because a fluke, because of chance. Then a friend of mine comes to my office and he says, why do you harvest a connective tissue graft and you put it on the back side of an implant? Nobody did that in Spain 20 plus years ago, and it was because I started using a tissue level implant, and I was afraid of the color of the implant to get exposed. So I applied periodontics to immediate implant placement.
So you developed this?
Yes, I did it by myself, and then I started researching about it, and some papers were coming up, but I'm talking about 20 plus years ago. I didn't have evidence, and many guys, when I started lecturing, because my friend finally convinced me to lecture, were criticizing me. They were saying to me, you don't have evidence about that. But look at the social media right now.
Yeah.
How many, because, and I usually say, about social media, there are bad things, but there are other things that very, very good. For example, it allows you to connect easily. And in my opinion, social media have done more for mucogingival procedures that the whole world of periodontics in 50 years.
Yeah.
And social media only in 5 years. Only in 5 years, mucogingival procedures skyrocketed. Because at the beginning, I remember I've been for more than, I think, around a decade into social media. Every time I uploaded a mucogingival procedure, many people were surprised.
Yeah.
And because
they'll
of
get
social
interested
media,
about it.
I ended up like this.
Yeah. No, not I maybe I will disagree with you because you are good of what you are doing. That's why the people likes to watch you what you are doing and they want to take this knowledge from you. And the social media is only the link.
Yeah, absolutely. Yeah,
Yeah.
is the kind of showroom to reach many parts of the world nowadays, and that's the reason. In the end, my life became quite complicated because at the beginning I was lecturing all around Spain, and in a few years my professional career as a speaker skyrocketed. I ended up lecturing in the main podium of Proso Perio Implant Society in Spain. But then I had to learn English. I didn't speak English 10 years ago, So I had to learn English because many people from other countries were asking me to lecture about different issues. And now I'm happy, but before the pandemic, I burned out. I wanted to stop for 1 year. It's not easy to be a professional speaker, I would say. We were chatting about that before. Time management is quite complicated.
So the difficulty is from the time. You have to make special time to prepare good material that you can show them to the audience. And this is very challenging because you have to spend a lot of hours preparing this. Then you have to spend a lot of hours traveling. Then you have to leave your practice and your passion to generate new passion. And this is so difficult. So how you manage that?
Yes, well, I had to reorganize my whole professional and personal life. I realized after a couple of years that this was not anymore a kind of hobby, because when you start and you give a lecture from time to time in your own country, it's easy. And people are not so demanding, because you are not in the big professional stage. But I try to be professional in everything I do. If not, I prefer not to do it. So I realized after 2-3 years, this is not working anymore. I have to reorganize my office. So I reduced my practice. I cut off half my practice, Thank God I had a team. I already had a team. So for me, it was easier than many, but probably for other guys without a team. My team was already big. Of course, I had to hire more people, but I could continue with my practicing and reducing the number of hours I practice, because if not, it's impossible. And on the other hand, I had to take care of my quality time with my family and my friends. That's something that is also
This is
part
your
of the
life.
cake. Exactly.
Yeah, life is not only working, right?
Exactly. And actually, I'm a guy who don't like to speak about teeth when I'm having dinner with you or having lunch, I have my hobbies, but I also protect my private life, You could see if you scroll down through my social media, you hardly see anything about my personal life.
It's only dental, purely dental and blood.
Exactly. And you know that there are this kind of two profiles: the guy who makes personal with professional life. I was interviewed a couple of months ago, a few weeks ago, and they said to me, "Yeah, I see that you all always showing professional things, never personal things. I know that people like to know about personal things, but I don't really like to expose my personal life. So I try to protect that because you need that for your mental health."
Yeah, it's personal preferences, but also people wants to see you as a human, not
Yes,
only like a professor or lecturing.
I
People wants
understand.
to see because they will feel more comfortable to deal with you, to speak with you.
Yeah, I understand it, but at the same time, I think part of me is an introvert. I don't have any problems. I wouldn't say fully an introvert, but part of me is an introvert, and I want to be alone from time to time, and I hike, I go with my bike with my friends. I have, these moments to disconnect from the dental world. But the rest of the time, I'm working. I still work very hard. I reduced the hours I practice with patients, but then I practice a lot. I work a lot with the computer, sending emails, answering questions. You know how that we are always connected.
When and where was the first international speakers you got placed
Yeah,
there?
I gave the first international lecture in Argentina in 2014, 10 years ago.
How many hours takes you from Spain to Argentina? That's two.
Actually, it's a lot, 12 hours, around 12 hours. And that's the reason after 2 or 3 years, I realized that if I traveled forward and backward, I would kill myself. And that's the reason I'm a speaker that every time I go out, I give several lectures. For example, I'm coming from Morocco, not from Spain, I told you. And from here, I move tomorrow after my lecture to Abu Dhabi. And it works for me. It's relaxing. I could spend 2 days off in Casablanca and Rabat. It's working much better than going forward and backward.
Definitely, yeah.
Yeah, because when I traveled to USA, for example, a couple of months ago, I was there for almost 3 weeks touring USA, and I do this every 1.5, 2 months. In the meantime, I lecture at my training center and I stay working at my office. But I'm able to combine this with the family and friends very well because I'm sleeping at home. My training center is in my hometown, Ponferrada, but the second one is my second house.
How many hours between
2 hours, very short.
close to it.
Yeah, short trip and in front of the sea. And the second one is 15 minutes away from the airport. Is in La Coruña, very beautiful city, and in front of the sea. And this is my vacation home. So when I stop lecturing,
Yeah, you go there.
yeah, I sleep there. And it was a kind of challenge because I was not very sure about how it was going to work. But I knew that I needed that place easily reachable by the guys coming from all over the world. For example, I had a group from Dubai only a few months ago there. I have groups from everywhere, Colombia, from USA, from everywhere. And it takes only 1 hour from Madrid to La Coruña. There are planes every 2 hours. And there we are in the middle of the valley, very relaxing atmosphere, looking at the sea and with swimming pool. So in that moment, I realized that you're right. For example, people want to be
Also relax.
exactly,
And
they
not
want to
only
be with
educated.
me as a person, not as a speaker.
As a mentor. They will take you as a mentor. They will
Actually,
look at you.
it's funny, but sometimes they are asking me about time management, about Ramon, you know what? I have this problem with these employees. I don't know how to organize the office much better, or how do you do this or that. But it's funny that many times they are not asking me about procedures. They are asking me about how to run their professional or even personal lives.
Yeah, because this is so important to them.
Absolutely.
Because as we mentioned, time management is life management. So you have
Exactly.
to separate your personal, and you have to separate your practice from the family and yourself.
Exactly.
Then you manage that, I think, by delegating the work to the other. You trust them, you let them work for you. Otherwise, you cannot work everything, right?
Exactly.
But some of the people, they have lack of time management, and I noticed that. And the people which they have lack of time management, of course, they will have lack of efficiency and delivering results. So this is a very good question to ask you, like, how can you manage your time? Because you have very good experience with managing the time, because running a practice and managing a training center with two branches and traveling all over the world, I think
And
this is very hard.
And that's a question they ask me very often because some of them are very successfully professionally. They have big offices, but they are struggling because after being so successful, they have a family and they have sometimes more employees than me, 40, 50. I have friends very strong in the field of dentistry. And then they want advice, and I understand it. And I always say that the key point for me is the teamwork, you know. And I already mentioned that I had a team before becoming an international lecturer.
How many of them do you have?
I have more than 25 employees, you know, but in this, the key in this time management issue is my wife. My wife is my boss, but not only at home, at the office as well. And she's the one, she's the manager of the business, and she's managing my agenda, and she's managing the employees and the economical issues. And this is extremely important. I have another 2 people in my team who've been with me my whole professional life. And this is another
Personal assistant,
another
kind of
keystone,
personal assistant.
yes. Because one of them, one, of course, at the same time, one of them is the head of the reception area. And another one is the one taking the pictures. Many guys ask me, do you take the pictures? No, I'm not taking the pictures.
You don't have time for that.
Yeah, I don't have time. And not only that, I cannot take out the gloves 100 times in the middle of the surgery, you know?
It's impossible.
And Monica being with me my whole life. And Sandra as well. But these 2 persons come to the office thinking about their own business. You know, I can feel that sometimes I have to say to Sandra, what are you doing here? Your shift is over. And she says, no, I still have work to do.
Well, you are lucky to have...
Yeah, I have 2 people like that. Never abandon me. You know, no, whatever happens, they are with me. And this is like going to fight with 2 generals. You know, it's not the same. And I have my wife, always supporting.
She's the manager.
She's the manager.
Did she fire you?
From time to
Many
time,
times,
punished me, not fire, because you know this is a good business relationship. In the end, you know? I'm the most productive employee. But and this is true. This is not a joke. Many times, some of my friends, now friends before students, said to me, "Now, Ramon, we understand how do you do it." After coming up here, you know, and we met Araceli. Araceli is my wife's name.
I met her when last time she came here. She came to the lab.
Yeah, exactly. You know her. So you have to think about this. I'm not the one doing this. There are many people doing this around me. And of course, I am maybe the connection, and they send me things to check out, but I'm not doing everything personally, because if I had to do everything personally, maybe I could be able to give some lectures in big meetings, but I couldn't cope with so many activities at my training center. I have a 2 years program for people around Spain and Portugal. I have many international groups coming up. I have lectures every single week. Sometimes I have 2 lectures in a week, and I have a group of people over my shoulder, because when I'm doing surgery, people from all over the world right now, not only from Spain, are over my shoulder every single week. And this is organized for me. I'm not doing it. So I want people to know that I'm not doing everything. This is a team approach.
Yeah. Okay. Do you have any plan to let somebody lecturing instead of you, or making hands-on instead of you, or helping you, assisting you?
No, I don't think so. And I will answer.
Why?
I will ask. Why? Because I realize that because what you said before, people want to stay with me. People want me, and this is the hardest thing about this. This is not this is a special kind of business. This is not a manufacturing facility.
It's individual business.
Exactly.
More individual.
Exactly. So it depends on you. It's good on one side and bad on the other. It's very difficult to delegate. Of course, I have friends. I invite friends to lecture at my training center. Quite recently, a friend of mine was there, and I will have many others because I have a study club. But you know what? Even with these friends, well-known speakers, people are reaching my training center, and at the same time, I had to give a lecture in Madrid. I was not there, and people reach the training center, and they are asking immediately, "Where's Ramon?"
Yeah.
Because they became they became friends of mine, and many times, once again, they don't want me to lecture for them. They want to speak with me. They want to be with me. They want to have a drink with me. Sometimes I realized many years ago because they told me, "Ramon, you know what? What do we enjoy the most is to have a beer with you this couple of hours after the lecture and to speak with you about this issue or the other, and thank you for this advice or whatever." And I think this is one of my strongest points, because I don't know why, but I don't know. I'm not the political diplomatic guy, but in the end, people tells me their problems. I don't know why. They are using me as a psychologist or even a priest, I don't know why. I think it's because I'm quite honest. I try to be honest.
Because I read the book. Its name is Emotional Intelligent. What he said, that if we sit down together, or if a group of people sit down together, that the information will be transferred from mind to mind without speaking any single word.
Yes.
So when they sit down with you, that's why we are telling webinar is not like physical attendance. Yeah. Because physical attendant, that they have this
emotional connection.
Yeah, in webinar, everyone will remember COVID-19 maybe.
Yes,
That's why no one like it.
Absolutely.
And that's why they have to attend. They have to ask questions. The way which they ask a question, the way which the eye contact happening between the people, I think a lot of information will be transferred.
Absolutely.
Yeah.
I absolutely agree with you.
Yeah. Now we have the practical practice and we have the academical practice. So do you feel there is any gap between them? Like if somebody is very good in academical but is not that good in the practical, of course you face like this student or practice. So do you feel like there is a gap between them, and how you close this gap? Because you are the best man who is doing academical and the best man who is doing practical. You are strong with both. So how you close the gap between
but not so strong in research, for example. Now I'm enjoying much more writing papers and writing many more papers than before, every year more and more. And I enjoy it because I'm a guy who likes challenges, to know new things, to learn, to keep learning. For me, this is exciting. I was a terrible writer at the beginning because I was not a researcher. Because in the end, when you're young, you have mainly one profile. Or you love to be a clinician, or you prefer to be a researcher. To be both is almost impossible, because it requires, every single field requires a lot of
thousands
time.
of hours.
Exactly.
Yeah.
Exactly. Thousands of thousands. I'm not a researcher. I'm a clinician. I'm 100% a clinician, but I love to publish, and from time to time I love to write. And what I'm doing right now is to publish the papers I would like to have many years ago. For example, I didn't have a paper. We published 2 papers about ponticide development from the periodontical point of view, but also the prosthodontic point of view. And I didn't have that paper at that time. I didn't have an article telling me how to do step by step this procedure in order to get a good result. But in the end, I'm a clinician. I'm doing this with my good friend Jonathan Esquivel from Louisiana University. And this is exciting for me. And combine both, as you said, is extremely difficult because it requires even more time. But it helps you to become a better professional. Lecturing is a way to become a better clinician as well. Why? Because sometimes you're a little bit tired, you don't You don't have the energy to read papers. But if you have a presentation,
You have to.
Yeah, you have to.
Yeah.
In 4 weeks or in 2 months, you say, oh, I have to prepare my presentation a little bit better. I have to update my knowledge. I have to, at least, I'm not going to read every single paper, but at least I will check out what the conclusion of the main paper say, and I will read a couple of them or the 3 most important things. And so there is a feedback between both of them, between those fields. If you're a good clinician, you can end up with a good presentation. But if you prepare professionally your presentation, not only with pictures, but also some papers, and you prepare the background of the presentation.
Because it's medical. It is medical.
Exactly. And from time to time, you keep learning, and you have new ideas from other guys. And when I'm traveling all around the world, I don't know everything. But I'm getting better because I come across very clever guys, and I usually say that everyone knows more than you about one thing. And if you get that thing from this guy, another thing from the other guy, in the end, you're richer. You know more about your field at the end of the year.
Yeah, that's what they call the travel broaden the mind.
Absolutely.
And I think you are the most man. You traveled all over the world. So what experience did you get from the travel? What the valuable experience, the most valuable experience?
I really love it. I became not only more open-minded, but more independent. I mean, I think I don't believe anymore in labels, political labels, or I don't care about your background, what country you are from, I get along everybody easily. I don't care if you are Arab. Actually, I have many friends. Well, it's easy because my wife said that I was a little bit Arab, before. But I get along Arabs. I had friends in Russia before. I have many friends all around the world. So you become more independent when you are able to understand the other guy in front of you much better without saying, I think like this or I think like that. Because before, maybe I had narrow ideas.
You hear about it from the ministerial media, or some friends told you about this culture and the other culture. But when you go there, when you step on your feet there and start talking with the people, every culture is wonderful.
Every culture. I had amazing time. For example, I traveled to USA a lot. And political issues, I cannot go to some countries, but not because I don't want to. You know what I mean? But actually, now I'm able to pick up around 1 or 2 out of 10 lectures, 10 invitations. And one of the main reasons to pick up an invitation is to know new people and new places. And to experience the food. I like everything. I don't have allergies.
But you don't have Billy. You are fit.
Because I try to sport. I like.
Which sport do you play?
I swimming, but also biking. I love biking and hiking, but mostly biking, mountain biking. Mountain biking. Sometimes I get lost the whole day. The whole day from the morning to the night. We stop by. We stop having lunch in the middle of the day, and I love that. Of course, when I get home back home, I'm destroyed. Sometimes 90 kilometers, something like that.
Whoa.
Yeah, this no, but relaxing. I don't.
You stop. You take some snacks.
Yes, exactly. I'm chatting with my friends. I'm not competing anymore. I don't have apps about controlling them because I had them in the past, and the problem is that I'm always working. I'm a professional speaker, I would say right now. So I don't want to compete anymore, man, because I
want to get relaxed.
Exactly. Yeah. I was competing with myself, looking at the watch, if I'm able to make it quicker or whatever. And I said, after 2 years, that's enough. And another thing difficult for me was after one day in the mountain bike, I reached back home, and with the application uploaded your route, and hundreds of guys were testing me. Well done, whatever. Oh, that's too much. Do you understand me? That's too much sometimes because I need to be alone from time to time. I need to disconnect. I don't want to. I love biking because my friends don't care about it. Don't speak about it. I don't. They don't care about it. So nobody's gonna ask you about teeth or whatever.
Yeah.
So in those moments, I feel grounded. I connect with myself. I feel that I'm the kid I was, 35, 40 years ago. Yeah, connected with nature. We're not worried about anything at all.
And your telephone, you're not touching it, checking
No,
it
I'm not
at all.
touching
Where do
it.
you put it?
Actually,
You leave it with you?
and with in the in-flight status, Actually, I have a joke about that. Many years ago, when I started being a lecturer, my wife complained about about me reaching home and chatting with dentists and answering questions or whatever. And now my wife complains about why do you have a phone if every time your friends wants to call you, they have to call me before because once I reach home, I disconnect the phone.
Yeah.
I disconnect the phone immediately.
I admire you. This is very good things you do.
Yeah,
Very
around 7, 8 p.m.
Wow.
And for the last years, but only after burning out. When I burn out, actually is said, and it is true, that what doesn't kill you makes you stronger. When I burn out, I wanted to stop working for 1 year. And my wife said to me, "What? You should think this before having 5 kids. We have 5 girls. This is too late. No way. You are crazy. No way." And then I stopped. I started doing this, and I recovered with the sports. I didn't have to take pills. I don't take any pill or whatever. I recovered with sports and nature. I wanted to be the guy I was when I was raised in a small village without worrying about my future, about anything. I wanted to be a person. And now, since the burning out before the pandemic, you can imagine, I cannot say that, but the pandemic was the best time for me, but I couldn't say that at that time because many people were struggling and dying and all of us were afraid. We can laugh right now, but it was a serious moment, But for me, I discovered that there was a life behind so much work.
That's the pandemic, what's did with the people that make some life balance. And this, when you go for biking, for mountain biking, and you disconnect your telephone, I know here some of the companies, real estate company, I have one friend there working. You know what they are doing? They are going to the desert for 1 full day, from morning, from the sunrise
That's
to
what
the
I do with the
sunset,
bike.
without like their group of people, like 200 people. They are crossing the desert, and they have only one Nokia telephone without, like, it's not smartphone, and one backup telephone just for in case.
Exactly.
And
In
they
case
do
of
it
emergency.
all together. And my friend there, he's a manager. He told me it's very
Here
good.
in Dubai.
Yes, it's very good for the business culture. You build very good culture between the people.
You build up relationships.
Exactly. People will start talking to each other. They will start, they have problem. They come together to solve it. They want to pass this way, that way. So they can gather themselves and make planning and execute it. And that's amazing. That's what you do. But you have to leave your telephone at home. But this is risky,
May I tell you a story, a short story?
Definitely, yeah.
My friend, one of my closest friends, not a dentist, was becoming a little bit fat, too much. And he was struggling and with his job. His job, because he's a very responsible guy, running many employees. Not struggling with the job, struggling with the pressure, with so much work. We started biking together. And I said to him, "Would you follow my instructions? Would you do this and that?" Because he wanted to go to a doctor in order,
From the stress. The
lose.
stress is destroying the body.
Exactly. And he wanted to lose weight and he wanted to visit another doctor, do this and do that. And now we are going out together for the whole day. In only 1 year, he lost almost 20 kilos.
Oh, how we did.
And now he's becoming a drug addict, but adrenaline addict.
Sport addict.
He's sporting every single day.
Wow.
He loves biking, and he's waiting for me to go back home to go out. But when I'm not there, he goes out. But when I'm there, we were very good friends, but now our connection is stronger than ever, you know, because those days spent in the middle of nowhere with a mobile phone, you know, only chatting about the stupid and simple things and laughing a lot and joking. But this is what I really want to do in my free time.
Yeah, and this is the importance of the sport because it's releasing the stress, and that's what I'm teaching my kids. So number one quality is the health. Number one quality is to maintain the sport and get addicted to it. If you don't get addicted to the sport, then you will be addicted to something else. It might destroy you.
Absolutely.
And sport, it will build you.
Exactly.
But the other things like the social media or anything can get addicted to it. It will destroy you. This one you can release the stress because now the life is not easy. You know, you have to work hard, you have to be tough. And of course, you have to get stress out of this. You are fighting every day. You go like battlefield because there are many things happening every day. The market,
Absolutely
the economical things. So you have to get relaxed, do sports. When you do sports, you will release all of this stress. Then you will be healthy. Then you will think better. Then you have state of mind like nothing. Always you have powerful thinking to help you in the.
And did you notice that afterwards you become more productive? And the time you spent sporting, you immediately recover it?
Yeah.
And my friend is not struggling anymore with his work. He takes things not so seriously. But he didn't visit any doctor, any psychologist. Sorry for that. I don't mean psychologists are important,
okay, yeah,
but he didn't visit any doctor. He didn't take any pill to lose weight. He's doing it, controlling the diet. And every time you feel better, it's easier. It becomes easier for you to control the food you take, you know, and it's like a cycle. And now what I noticed that I reach my office and I'm able in one morning to do the same work I did in the whole day because I'm more focused. I'm happier.
Yeah, so it's a peace of mind. It's a peace of mind
exactly.
is the most important thing to do business and to parents, family.
Yes.
This is so important. I watch your social media and I saw a lot of beautiful photos for the soft tissue management and the pupilly, how you build them up. Is it for every patient you make it or some of the patients?
No, not for every patient. And actually, when I lecture, I say many times because people think that I'm always
Superman.
reconstruct. Exactly. No, this is social media, but I'm not reconstructing every papilla. For example, I do my overdenture, my hybrid dentures. I don't care about papilla there. And another thing is that the thing I say, I tailor every single treatment. I individualize the plan treatment for every patient. There are patients, for example, for a young patient like you, I would love the perfect papilla, but not for maybe you are now, imagine you are 80 years old. You want to come to my office, you don't care anymore about the aesthetics. Even me, you know, people say to me, "Hey, Ramon, I know a doctor. I have a friend who recommended me to put hair." You know, you know, and I said, "What? If I put hair, I don't recognize myself." You know, imagine you are 80 years old and you don't care about that. You want to my office to have a
function,
good solution, aesthetic if possible, but you don't want to come back 40 times. You don't want FP1 maybe, you know. So you have sometimes some patients have medical conditions or whatever. So for me, what I learned throughout time is that the best treatment for a patient is the worst for another. So no, for sure not. But of course, I have some doctors send to me difficult cases, young patients. Looking for with high expectations,
FP1,
looking for FP1 results, or even worse, vertical bone regeneration, where the goal is not to get bone. The difficult thing is to end up with a good aesthetic result. And in those cases, I do my best, and I do really love challenges. Because after so many years practicing, there are guys who don't like them, but I love them because for me it's like in sports is like a challenging you. That's the reason I do not challenge myself anymore in sports. You know.
Yeah. So this this will take us to some very important subject that dentistry in the university, they teach you the technicality of the dentistry. But
Absolutely.
the other aspect, which is the most important part, the psychological of the patient, how to deal with them.
I couldn't agree more.
Yeah, how to educate them.
Absolutely.
Because I was in one clinician for my wrist. I have small injury there. I went. He told me clearly, I will do this for you, but this is about your body. If we failed, it's your body, it's not my body. And thank God it was good running. But in dentistry, no, the patients was everything perfect. And if you failed, like it's your body, no, they don't understand. So how you educate your patient? Where you start with? Of course, trust. Like patients should trust you first, then they have to listen to you. But how you start with the patient, educating the patient?
Yeah, that's a good question. First of all, experience is very important here. And that's something that you don't get in 1 year or even 5. Because there are, for example, some patients where I could get a good result. Imagine very challenging cases, horizontal and vertical regeneration in the anterior area with a gummy smile, asymmetrical situation. Those are the most demanding cases. But imagine the patient couldn't cope with the frustration. Some patients cannot cope with a possible failure. So psychologically, this is not the patient. This is not the ideal patient to treat, unless you are so sure about your possible result that you can guarantee no failure, and this is almost impossible, even if you are an expert. So first of all, I speak with my patient, and I speak about the risks, and not only the advantages and disadvantages, the risks. And then I observe psychologically, and you mentioned before the body language, I observe his or her reaction. You know, for example, if I remember a woman crying immediately after saying to her, there is a small chance of failure, and I didn't want to treat it. And I think it was good for me because I don't want to treat a so weak psychological profile. Because in the end, as you said, you have this knee problem. It's not mine. I'm the orthopedic, but you have a problem in your knee. I cannot guarantee 100%. You know, maybe I get 98% success after so many years because right now, for example, I will tell you that I can't remember the last soft tissue exposure because I mastered the technique. But even so, we are not God. We are human beings. I can make mistakes, and not everything depends on me. The compliance of the patient is so important. If the patient stops smoking, the health of the patient, the general status of the patient. So to get this psychological profile, you need experience in order to get that feeling. You know, I would say, I know when a patient is going to cause me problems, you know, and I know patients.
Did you reject some of them?
Yes, from time to time.
Because of the psychological thing.
Yes, few of them, but I reject some of them.
You want to help them, but you see, like it's like
and I can detect when they are lying to me. A human being is.
You can see.
Yes, you can see. You know, so the best approach is to be honest, of course, to speak about the risks, to say I'm not God, but most of the patients can be treated because most of people, you know, are very good people and they are compliant without any problem. But of course, I couldn't agree more with you, and probably you are speaking about that because you have a long experience. Yeah. And experience means failures in the past.
Yeah.
When you didn't expect them, when you did everything well and something failed, and not only failed, you stopped to analyze what was the reason. You, the patient, or sometimes choosing the wrong patient. And in every textbook is written this: case selection is very, very important. Case selection. But once again, I agree with you. The education is focused on only on the technique, and this is for me one of the defects of dental education. We have to keep working on this to send a message to young doctors that no matter how good you are with the technique, if you selected the wrong patients, you're gonna fail a lot.
Even if you use the best technique for the patient.
Even if you choose the best technique. I'm surprised that in every perio textbook is well defined that in order to, for example, perform GTR procedure, tissue regeneration, I mean a periodontal defect, you need a patient with a very high compliance. The mouth has to be almost perfect without plaque. And I'm surprised that many young practitioners, when they look at the radiograph and they see the defect, they say, I want to do this surgery here, but you didn't see the gums. Sometimes they send you a message, could I do this and that? I didn't see the pictures. I don't know the patient. I don't know if the patient is cleaning properly.
Yeah.
This is crazy. And that's the reason sometimes they fail. Not because they're bad with the technique, because they didn't select properly the patient.
Where do you enjoy more, prosthodontist, doing prosthodontist or periodontist?
I think I enjoy more the blood, as I said before, because blood is a kind of adrenaline for me, And it's true that I love these minimal invasive techniques, but where I'm really happy is with big flaps. When I have to regenerate in the middle of the blood, I'm like a fish in the middle of the ocean.
Wow. Even I saw your the prosthetics parts, the bridges and the prosthetic parts, they are amazing. I'm a dental technician and I can evaluate the work which you are delivering aesthetically and, like, of course, functionally and biologically. It's amazing. Of course, they will not deliver to you this until they know that you know the quality of the work. Mm-hmm. You order this quality of work so the technician can deliver it to you.
Yeah, because you know very well, you know your job. Sometimes even if you are the best technician, when you cannot see the face of the patient and the soft tissues, and then when I go for the big trying or something like that, I retouch a little bit here or there, not because the technician is bad. I always said to my young students, you cannot ask for that to the technician because we are working. One thing is working with the model, another thing is working inside the mouth, and you have to do this kind of retouches, tiny retouches, and then send it over to the technician with the right information. Look at this in the face. It was perfect in the model, but in the face we have a little bit tilted, the plane. I corrected this, and maybe the embrasure, the incisal embrasure, a little bit there, And so once again, the team approach is much better in order to reach a top result. I pay attention to this because I started practicing as an orthodontics. Mm-hmm. And if you know orthodontics and you want to end up with a good result, you need to know about occlusion, about the torque of the teeth, about the occlusal plane position, about
the mandibular joint.
Exactly. If not, you start well, but you are not able to finish with good results. Orthodontics, then prosthodontists, helped me a lot in the surgery because my implants are prosthodontically driven. Yes. For me, an implant is a
This is the most important
prosthesis.
Thing.
Yes.
Because we are doing surgical guide, it should be prosthesis-driven planning all the time. So that's good. You have all of this. Because two things makes the all-on-6 or all-on-X bridges feel, in my view, that two things is first the fitting, second the bite. If you fix them in proper way, then you are 95% good. You will divorce the patient. You will not see them again. But if there is questionable, you cannot take proper bite and send it to the technician, then you deliver for the patient. Of course, they will have some issues and problems.
And I always say, And soft tissue grafting now is very trendy. And I always say, watch out. Second, soft tissue grafting is the second. The first one is the position of the implant. And that's the reason we wrote a paper about that, the position of the implant. You make 1 millimeter mistake in a lateral incisor, and now the prosthesis is going to be 10 times more expensive. You need a customized abutment because you cannot use anymore a tie base. Now we have nice tie bases with different gingival heights. You cannot use it anymore because you are compromising the lateral bone. So one single tiny mistake and you are putting the technician in an impossible situation. And I say to the dentist, you cannot ask for a good job to the technician if the implant is not in the perfect position.
That's true.
Yes.
I agree totally with you. Yeah.
And some doctors say, no, I put the implant here into the bone, and now the technician is gonna deliver the amazing prosthesis.
No, it's impossible.
It's impossible.
Yeah, that's impossible.
Of course. Yeah. But it's imagine in architect. This is because the profession is very new. But imagine you are an architect. And you put the pillars whatever you want.
You cannot build the building.
Exactly.
Definitely.
That's
not.
crazy.
Yeah.
And not only that, you would end up in jail. You do that. I'm sure.
No, here you'll not end up in the jail. Maybe in Spain you would end up in the jail.
but in Spain, if you are an architect and you put with an architect,
architect, definitely yes.
Exactly. But in the future, maybe we have to assume that we have the responsibility to put the implants in the right position.
Yeah, especially now with the digital dentistry, it's so easy to place it in the proper way, proper position.
And now there is no excuse, because before you could tell me that for a single tooth, I always say for a single tooth, maybe a surgical template was very expensive. Not anymore.
Yeah.
Not anymore.
Definitely, yeah. So getting back to MEDA, I'm really obsessed with MEDA. MEDA is like now becoming very famous. How can the people from like international students or international dentists wants to make courses in MEDA? Where can they go?
They have two main options: group courses with hands-on and sometimes live surgery. They come right to medaformacion.com or medaformacion@gmail.com. My team is gonna answer immediately, or in a couple of days. Sometimes during the weekend they don't answer. And the other option is clinical residencies. They are with me over my shoulder. My whole year is sold out, but I recommend always to organize a small group, because groups are
less costly for them will be.
They have a better rate if it is a group, and they can write to Araceli, and they can get better fees if they organize themselves, because it's not so hard for my wife to organize everything.
Wow, wonderful. Then we will leave the link for you. You can press there, and if you want to attend one or many of the conferences or courses, you can click the link and register yourself there with Dr. Ramon Gomez. Did you suggest the practices to read any of the books? What is your suggestion? One book.
I'm writing papers. I'm writing papers. When they recommend me to write book, you are telling, when they ask me about books, you mean about perio or prosto?
Give us one perio and one prosto. Let's be more generous with
this. Yes. The prosto, I would say Fradiani's book, about aesthetics, and
he has many chapters.
Yes, a couple of books, I think. And about perio, I would see Naoshi Sato by Quintessence, because Naoshi Sato, there are many good books, but in Naoshi Sato's book you can see not only soft tissues, but also in the end I have the heart of a periodontics. I love to preserve teeth. GTR, not only soft tissue grafting, amputation. A book written by me and another friend is going to be released about autotransplantation. Sometimes people come to my office over my shoulder, and they are experts, and get surprised that I'm putting a wisdom tooth in another position, and I've done hundreds of cases. So it's not only about soft tissues, you know. I care about your mouth. Sometimes I don't put implants. Sometimes I reconstruct with bridges of tissue, bone, autotransplantation, ortho-extrusion. So this is a comprehensive book about periodontics. If I have to speak about one, Nausisatus and Fradianis in prostos. And people ask me about my book, about the future book, and I say always, I prefer not to write a book for two reasons right now. First of all, because I burnt out in the past and it takes too much time. Secondly, because when you write a book, I keep learning, and when you write a book, it's outdated very easily, you know, and then you continue lecturing about the book, and then because you have to sell the book, you know, and I don't like this. You don't like.
No, but maybe
in the future.
You to make
now we are writing papers. Before, for me, it's more important at the moment to write papers. And if anyone want to read my paper and they are not able to find it, they write to me. I will send them the PDF they need without any cost. Okay.
Awesome, Dr. Ramon. Maybe we can speak until tomorrow and we'll not finish.
Yes,
it was a pleasure to have you here, but we have to wrap up. So thank you very much for being here. And hopefully we can make another podcast because of a lot of information you give. So, and yes, thank you very much for watching Charismatic Podcast. Dr. Ramon Gomez is here, and we will see you again.
Thank you because I had lots of fun, and I didn't know what was the topic, but it was quite easy to speak with Eham here. Thank you. I appreciate you inviting me to be with you once again, and in the future, if you have the opportunity to repeat the experience, I would be more than happy. Thank you so much.
Pleasure. Always pleasure.
It was easy.
It's just conversation. So
yeah,
the idea, so whenever it's easier, it's more interesting.